All right, so now it's my pleasure to show everybody some variants on the traction. Now, technically, what I'm going to be doing isn't a modality. We're not using anything except our hands and potentially a bed sheet to pull traction. But we will cover it because it's covered in the book, and it's good for you guys to know while we're talking about traction in general. It will be covered, I believe, as well in orthopedics. But so when we're pulling lumbar traction manually, the easiest way, if the patient is able to relax, and again, we'll talk about the contraindications and relative contraindications of traction, both manual and mechanical in lecture. But when we're pulling manual lumbar traction, the easiest way is just to kind of grab around the ankles right here. In order to lock the hips out, if the patient can tolerate it, you're going to give them a little bit of internal rotation with both legs, and that's going to make sure you're not just pulling traction on the hip joint. When we give that internal rotation, it tightens up the ligaments that connect the femur to the pelvis and allow us to actually transmit that force more effectively to the lumbar spine. So when I do that, I just roll the ankles in, and notice that my hands aren't down here on the feet, they're up on the tibia. So internally rotating and then leaning back. You can see his whole body will start to move a little bit, and that'll vary a little bit based on the slipperiness of the clothing and the table. One thing I like to do, because one of the indications for lumbar traction, or one of the reasons we use it, is to get that nucleus pulposus inside of the disc to move around a little bit to help nourish the spine. So one little variant I will do is kind of sway back and forth a little bit. So you're that gives a little bit, as I'm leaning to my right, it pulls a little bit more traction on his right side. And then relatively the same, relative to the opposite side. And the same thing when I lean to the left. It works similarly to intermittent traction, and we'll again talk about the indications when intermittent is appropriate. But note as well that eventually your hands are going to get tired, especially if you're a new practitioner. I can hold this for a little longer because I've been doing it for years, but there are ways to use belts as well to kind of take the pressure off of your hands. You can wrap them around your wrists and the ankles of the patient if you have to do it for prolonged periods. Now the other variant, now this is obviously in relative extension of the lumbar spine. Let's say the patient isn't comfortable with that, if they have what some people term a flexion bias. We can also perform manual traction in flexion. Now you can do that by just pinning the ankles down like that, or pinning the feet, grabbing just below the knees and leaning back this way. And do you feel a difference in where that's pulling, Craig? Does it feel a little more superior or inferior? Do you notice?
I felt it more like pressure-wise on my sacrum, kind of, with my legs extended when you were leaning back. Like that's where I felt friction or tension, whereas in this position, that's kind of taken away.
Yeah, and typically when you have them more in flexion, it will move the feeling up just a little bit more proximally in the spine. It varies based on the pathology though. The other way, if you're going to hold this for a prolonged period, again, you don't want your hands to get too tired. So what you can do is wrap a bed sheet just underneath the knees, and then I can just lean back. Is that comfortable? Mm-hmm. You can kind of do the same thing. You can give them a little wiggle, or you can pull yourself up, give yourself a little workout, and that will cause effects similar to that intermittent traction. There you go.